Hi, this is Melissa Herzog, and we are going to look at the axial skeleton today. The cranial bones of the skeleton are the frontal bone here. You have two parietal bones, 1 and 2 here. And then we have the occipital bone right here, that would be the back, and the temporal bone here. Now we also have the occipital protuberance right here. It's kind of like a pointy little portion of the skull, and that is the attachment point for the ligamentum nuchae. I hope I'm saying that right. The external view of the temporal bone, we have the temporal mandibular joint, which is the joint between the temporal bone and the mandible. So this would be the joint right here. And let's see, what else do we have? The mastoid process is right here. The styloid process is a little bit difficult to see, but it's kind of a pointy bone right back in here. That would be the styloid process. We have the external acoustic meatus, which is right here, this depression. And the squamous part of the temporal bone would be right through here. Now the internal view, let's take them down for a second. The internal view, we have the petrous part of the temporal bone, which I believe is right in this area. And it is, it houses the middle and internal ear cavities. The internal acoustic meatus is, so this is the petrous bone, and this is the cavity. It houses the cavities, and right here is the actual internal acoustic meatus, which we have cranial nerves 7 and 8 passing through. Now we're going to look at the sphenoid bone, which is this one here. That would be the external view. The internal view, actually, this is the external view of the sphenoid bone, and so is this area here. It's also got a fissure, this black area here. The fissure allows cranial nerves 3, 4, and 5 to pass through it. Now the internal view is, this would be the lesser wing right here, and the greater wing through here. The optic canal, which is here, that allows the nerves, the 3, 4, oh, you know what, sorry about that. It allows cranial nerves 2 to pass through it. This is the sella turcica, which is kind of like a depression right there that the pituitary gland sits in. So that's that. And then we have the ethmoid bone, which is right in here. I shaded it quite a bit. The crista galli is on either side. No, not the crista galli. This is the crista galli, this protuberance right down through the middle, and that is where the dura mater of the brain attaches to it, and it helps to keep the brain stable in the cranial cavity. Now the cribriform plate is on either side of this. It has lots of little openings on either side to allow the filaments of the olfactory nerves to pass from the smell receptors to the nasal cavity to the brain. Next, we're going to look at the sutures. We have a coronal suture here. This is the sagittal suture. This is the lambdoid suture, and this is the squamous suture. Now we're going to look at the facial bones. We have the maxilla here, the nasal bones here. The zygomatic process or zygomatic arch, which is here, which is actually part of the temporal bone and part of the maxilla fused together, and that forms the zygomatic arch. The ethmoid bone is right posterior to the lacrimal bone, so the ethmoid bone is right in here. The vomer is the bottom of the nose here, and it's formed by it forms the bony nasal septum, which consists of the vomer and the ethmoid bone. Now we have the mandible. This is the mandible. This is the body of the mandible. The mandibular, the angle. This is the angle of the mandible. The ramus here. Then there's the mandibular condyle here, and the mandibular notch and the coronoid process. Now we're going to look at the vertebral column, and we have two primary areas, which are the thoracic and the sacral, and the secondary, which are the cervical and the lumbar. So the vertebral column has 7 cervical vertebrae. They're the 7 that do not attach to ribs. So 1, 2, 3, 4, 5, 6, 7. This is the atlas right here, and this is the axis. And the atlas is articulates with the occipital condyle, so to allow the movement of the head like that, like so. Now let's see. Let me go through. Now we are going to look at the thoracic vertebrae, which there are 12. Each of the thoracic vertebrae are joined to a rib. So that's how you know which are the thoracic vertebrae. And like I said, there's 12. The spinous process is this pointy part of the vertebrae. The transverse process is here and here. The intervertebral foramen allows the nerve roots, blood vessels, and ligaments to pass through, and it's on the lateral side of the vertebra, which we could say is right here, if you could get a good shot of that right in there. This is the body of the vertebra right here. These are the discs that separate each of the bodies. Let's see, the lumbar, there's 5, and there are these 5, 1, 2, 3, 4, 5. And then we have the sacrum, which is also this bone here, but what it is the 5 vertebral bodies fused together to make the sacrum. And this area here is the coccyx bone. Then we're going to turn it around, and we have the sternum. This is a manubrium. No, I'm sorry, this is the body. This is the manubrium. This is the xiphoid process. Here is the jugular notch. Then we have ribs. We have the true ribs, which are all here. All of the true ribs attached to the sternum. The false ribs here are these 3 down here, and they do not attach to the sternum directly. They attach to this rib here. So these are false ribs. And then these last 2 here are floating ribs because they don't attach to anything. And we have the head of the rib right here, and it attaches to the vertebral body. And then we have the neck, which sits below the head, obviously. And it attaches to the articular facet of the tubercle by ligaments, and that is essentially, those are your ribs. And that's it. Thank you.